Hi, this video is the before and after hair transplant restoration surgery by me, Dr. John Diep. It's the FUE technique that I use on this patient to leave no visible scar in the back of the head for him. What we did was he was receding both corners all the way up here, and we lowered the hairline, but to create a perfect hairline with excellent density and naturalness to allow this patient to wear his hair shorter without visibility of scar in the back and without unnaturalness. And this patient leave his hair very short. Now if you look at his before and after, this is his before, and that's how he wears his hair short, okay? And this is his afterward. You see how natural his hair density is. And I will talk more about the art of hairline, and it requires a lot of artistic and aesthetic details, not just surgical skill, to ensure for natural and dense result. And just to show you another one right here, right side view and left side view. Okay, and this is what he looks like right now. I mean, I'm very happy with the result. His face, it really brings out his other feature and really frame his face, because it just the overall enhance the eyes, the nose, and all the overall facial structure. But the important factor is the naturalness and the density, and you can see through all this, and then he leaves his hair very short, around 2 centimeters, or 1/2 to 2 centimeters. And in the back, I will show you another video on the back where you can't see he had any scar in the back. It is there, but it's very hard to see, and allow him to wear his hair short. For the audience who want to know more about my work, go on to my YouTube, JG Diep, or go to my website, MHTAclinic.com, or 1-866-999-6482. And getting back to this patient, the artistic and aesthetic detail of hair transplant. And so how do we go and to create a natural hairline? I had to fix a lot of other people's work, because some of them, they did the hairline so high because they talk about mature hairline. I understand that's mature hairline, but it does not have to be halfway through the head. And so, and another client had a hairline so high but straight across. There's no art form, and it makes him look very unnatural. And so my goal is to create the hairline that's perfect for each individual ethnicity and each individual overall facial structure. The important factor is from the eyebrows and up is around 6.5 to 7 centimeters for Asian or African American. For Hispanic is 7. From the eyebrows and up is to the hairline is 7 to 7.5. Caucasian, from the eyebrows and up to the hairline is 7.5 to 8.5. The curvedness of the hairline depends on your facial structure. The more narrow the face, the more curve you have. The more round the face, the more flat the hairline is. And so this patient has in between. He doesn't have a very round face, and he doesn't have a super narrow. So he does have this curve, and I found out it's perfectly for his for exactly how his face is. The other important factor is you see how soft the front hairline is. I mean, he walked around, no one knows. He even told me his co-worker, his friend, no one knew about it, because that's how natural it grows up. Even during the healing process, because it doesn't look like there's patch here and there. He only mentioned about wearing a hat like the first month or 2 or something, and after that, when it started growing out, it looked very natural. The great thing about it is hair grows so slow that your look change very subtle, very slow, that no one knows you have had it done. And my famous line is, have you ever sit and watch your hair grow? You can't. So your colleagues, the people who see you every day, can't tell when the hair starts growing out. Your transformation will be very slow and subtle. You know you had it done. You know you bald, but you forget how extensive hair loss you have until you look at your picture before and you say, man, that's where I was. And for me, every time I do a surgery, I consider it as my work of art. So that patient's hairline and those stuff, that's my work of art. I really tell you the truth. I very focused on naturalness and density and the hairline. I mean, that's my MO. But not just the hairline, but the you know, the overall of the FUE, because a lot of clinic or the place, they say, oh, FUE is no good because it doesn't grow well. Well, it doesn't grow well because they can't do it, not because it doesn't grow well. See, that's what you have to look. I do both procedure. I do strip and FUE. So don't think I only do the FUE. I do strip too. Everybody, when you first graduate, you can do strip. But FUE is when you become more refined. You need a lot of your own skill, depending on the eye-hand coordination, but the technique and the skill of the surgeon. And then I invented my own instrument and my own tools. And then the technique how to do the FUE. But getting back to this patient, we did around 1,500 grafts. We did fill in both corner, and we'll reinforce the middle throughout. So I want to do out the hole like this, so that way it would try to blend in easy, because if you just fill in both corner, what if this begins to thin out? And that's why I try and do as much as I can that way. So so then the other important factor when I talk about the hairline fit your face, we talk about zigzag line. You see, no hairline straight. Even though I have that curve, you see it's up and down. Up and down. That's how natural it should be. The angle has very important. Start 35 or 45, increase when you go backward, and change it when you go different direction. So the angle, the zigzag, the softening, and we had to transplant the hair strategically to have it look very natural and soft. So we put all the roots, we group them, and place all the single root in the front to make the hairline soft. In the back, we put the root to grow 2 hair, 3 hair, 4 hair in the back for vocal volume. And because the back is density, the front is softness. So this is the before and after hand transplant restoration surgery on a patient who had an FUE done by me. And I just want to run through my hand just to show the audience it's very natural, and that's with his real hair. It will continue to grow. Before I finish, I just want to show the audience this is what he looked like before, and this is what he looked like right now. Thank you.